Lenny, thanks for being here. Oh, Reg, it's so good to see you. Everybody say hi in the chat. We see you, Reg. You look fabulous. You're amazing. How do you feel, buddy?
Wonderful.
Oh, I
I had
love it.
to get this together real quick.
I make that happen, don't I? I'm a disaster. I'm the biggest bully in town. But look at everybody saying hi to you.
Hello, everyone.
It's easy. So why don't you introduce yourself to the crew here?
Well, I am Reg, of course. I am a kidney disease patient, a kidney transplant patient. I was introduced to GLP-1s almost 3 years ago when I first got kidney disease. And I was trying to get a kidney transplant, and I didn't have a clue of how I was going to lose weight. At that time, I was 421 pounds. My doctor went back in my charts and realized I was actually more than that. I was 450 pounds. And when I was trying to get on the transplant list for a kidney, they told me I had to lose almost 100 pounds to even get considered for a kidney transplant. And then my nephrologist, kidney doctor at the time, and still my kidney doctor now, told me about GLP-1s. And I had no clue of what he was talking about. And he says, if you want a kidney, I think you're going to have to get on these meds to lose this weight. And so I was introduced to the medication. I got on the medication and the pounds started coming off with proper diet and exercise. I started walking like 2 to 3 miles a day with severe kidney disease. And so I pushed myself because I was determined to get a kidney transplant. And so over the 2.5 to 3 years now, I am down approximately 180 pounds. I am now 233 pounds, and I'm still on a GLP-1. And yes, I did get the kidney transplant. So I was off of the medicine for a little while, and the weight started coming back. And my transplant doctor last July told me, hey, we got to get you back on this medication so you don't end up back in the 400s again. And so I'm thankful he did, because I ended up being 274 pounds. And like I said, as of today, I am now 233 pounds. So that's the short end of the story.
Ah, I love it, Reg. Thank you so much for sharing. If anybody in the chat has a similar story or dealing with any sort of
Thank
kidney
you.
issues as well, please let us know in the chat. It's kind of nice to be able to have questions answered or talked about when you're dealing something with something similar like this. Reg, that's amazing. So ignorance here when it comes to kidney disease and what you dealt with. How did you feel? Like, what do you feel? What is life like with that situation?
Well, first of all, I tell everyone now to always look at your blood work, always get your lab work done. And I think it's very vital that you ask your doctor.
Very vital.
Yes, very,
Rocco.
very vital to ask your doctor, what is my kidney function looking like? And we were actually talking about this because, I'm in the support group for the National Kidney Foundation every first and third Mondays of the month. And a lot of us kidney transplant patients and kidney disease patients talk about that your doctor really doesn't really say anything when you're in stage 1 kidney failure, because the reason why they don't really say anything is because you're still functioning like a normal individual. But as kidney disease patients, we realize that I want to know I got kidney disease. Don't just bypass it. I don't care if it's stage 1, 2, or 3. I want to know I have kidney disease so I can take the measures that I can to prevent it from progressing. And I see a hand.
Well, I want to do that so I don't interrupt, but I'm going to interrupt politely.
Okay.
Now, now that you're saying like, God, tell me I'm in kidney disease 1 so we can have a change, right? So they don't want to shock you yet. They don't want to talk to you yet. But if you did know, would they start working on something then to help? Or are they actually working on something then without telling you they're working on something so that they just don't shock you into like knowing that you have something like that?
Well, what they will do is, well, what mine did when I was in stage three was when I finally found out, is they will tell you about, getting you in touch with a dietitian, a renal dietitian, so you can take the steps as far as your nutrition to figure out what things that you need to eat to help to preserve your kidneys. One of the major things that you really should look at, when it's in reference to your lab work, is always be familiar with your creatinine level and your BUN level. Those are indicators of what's really going on with your kidneys, as well as your GFR. So always ask your doctor, hey, what is my creatinine level, or what is my BUN level, and what is my GFR? And when they tell you those numbers, just say, so what does that mean? Am I in a good position right now, or is my kidneys functioning well, or do I have a little bit of kidney disease? Just ask them what's going on with those numbers and the reason why. Now, those numbers also can tell you if you're dehydrated. See, sometimes a lot of people don't realize that when you're dehydrated, it can throw your kidney function off as well. So it's very important to know those numbers. Ask your doctor about everything on your blood work. See, I'm the type of person now, when I see something that says low or high and it's out of range, I don't care. I'm asking about, well, what does that mean?
Right.
you know,
And I think too, it's interesting, like my personal opinion is even if it's in the range, if it's kind of higher or lower in the range, I still want to talk about it.
right,
Like I still think it's important because I think doctors will sometimes just kind of glance over that when in reality it's like, no, no, no. It could be still in the healthy range, but we're creeping up one way or the other, right?
right. So it's very vital to stay, abreast with your kidney function, because kidney disease, one of the things about kidney disease is it really can't be reversed unless it's acute kidney failure. And sometimes that's a if with that too. Sometimes that will reverse and sometimes it won't.
Yeah.
So when I ended up in stage five, I was stage four with for 3 months, and then all of a sudden I went to a restaurant and I was eating my breakfast, and as I was leaving, I could not catch my breath, and I didn't know, I didn't understand. Well, I said, "What in the world is going on? I can't catch my breath. I'm just hard to breathe." And so I got in my car and drove myself home, because I keep in mind I was supposed to go to Las Vegas that evening. I was supposed to catch a flight and go to Vegas. And so when I got home, I was came up the steps and I was like, I still just cannot catch my breath. So the group that I was going to Vegas with, I called them. I said, hey guys, I don't think I'm going to be able to go. And they were saying, well, what's going on? I said, I can't breathe. I said, I need to go to the ER. And so they said, okay, that's cool. Just let us know what's going on. So I drove myself to the ER. And once I got there, they triaged me. And when I sat down and get my blood pressure taken, it was 245 over 118.
The
Yes, 245 over 118. And they rushed me back into the back. They said, oh my God. And the doctor started coming in there because they thought I was having a heart attack.
yeah.
And they started ripping my shirt off, and they just, I was like, what is going on? What is going on? So thankfully that wasn't what that was going on. So they did blood work on me, and the doctor came back into the room later, that after all that had happened, and he sat down. When a doctor sits down, you like, oh, something ain't good. And he pulled up a chair, and I was like, oh, this is not good. And he told me, he says, you got to go on dialysis like right now. And I said, what? I said, and I was stubborn. I was like, I'm not dialysis. What? I'm not going on dialysis. I said, this is too much. I said, what do you mean? I said, he didn't really give me a chance to really think.
Mhm.
And so I was just really stubborn. I was in denial. And so the nurse that I had that day, she heard me just kind of just like literally going off. And she asked the doctor, she was, can you step out the room for a minute? Told the doctor that, let me talk to him for a minute. And she sat on the bed next to me and she says, honey, this is going to make you feel better. You need to go on dialysis. And if you don't go on dialysis, you won't be around here very long. And I told her, I remember her name was Becky. I says, nope, I'm not doing it.
Right.
And I said, this is ridiculous. I don't know what's going on. He telling me all this stuff. And And she says, well, what can I do to get you to do this treatment so you can feel better? I told her, I said, if you go down to the operating room with me when they put this catheter in, I'll do it. And she said, honey, I don't know if I can do that one. So anyway, she went to
Who
talk to
loves Becky? Who loves Becky in the chat? Oh my God. What?
so she went to talk to her charge nurse. And she came back, and the charge nurse said, yes, I can go down to the operating room with
Oh,
you. So she went down to the operating room, and for this procedure, when they put the catheter into your chest, you're semi awake and you're semi not. And she went down to the operating room with me, and she held my hand for the whole time I got that catheter put into my chest. And so my nephrologist that heard that I was giving them a hard time, he was upstairs in clinic, in his personal clinic, and he heard that I was giving him a hard time. He came down to the operating room, knocked on the door, and they were like, who it is? Oh, it's Dr. Hung knocking on the door. And they said, what's going on,
wait, what's
Dr.
his name?
Hung? Dr. Hung. They said, you don't usually come down here and to the operating room. He says, I came down here to check on my favorite patient, Reggie, because he was giving everybody a hard time about this dialysis. So my nephrologist and my nurse came to the operating room to comfort me so that I can get this catheter.
Because
And
we
it's,
love you.
yeah,
They love you, even though you're stubborn as hell.
I was. So I probably wouldn't be here today if it wasn't for those two.
Oh,
Yep, if it
I
wasn't
love
for
that
those
your
two.
nurse knew you needed someone else than that doctor at that moment, because doctors are, you know, they have to take that personal side of it out of it, and they're very factual, right? That's how they work. And so she knew, being a nurse, more empath probably, we need to have Reg, kind of chilled out a little bit, like heart to heart moment, even though you were still stubborn. And then that doctor, knowing how it really was, came back and loved on you afterwards. I love that, Reg. I thought, what a great story.
Yes, it
Wow.
was it was very, very touching. And then, my brother came up there and the nurse told him, your brother was stubborn. He's like, yeah, I know. And I said, I'm glad he wasn't here because my brother is he would have added fire to me being angry. So I'm glad everything worked out like it did. So, the kidney thing was very trying, and I had some incidents even during the treatments and different things like that. But I'm so thankful to God that he brought me through all of this because it was a dramatic time in my life. I'm telling you, everything came at me all at once. I mean, I couldn't even think straight. It just happened.
How long
So
ago was that again, Reg?
that was 2.5 years ago.
Okay.
So I'm just thankful. So I did have two kidney transplants because the first kidney transplant failed. Yes.
What? Reg!
I
Okay,
had
wait,
to.
hold on just a second. So that first one,
Mhm.
how long ago was that?
Go ahead.
How long ago was that first one?
The first one was July 17th, 2024. And so strange because my mom passed in 1995 on July 17th, 2024. And that's when I actually had the first kidney. And so I had my second kidney April the 28th. And that's strange too, because the month of April is when my mom went into the hospital before she passed in July 17th of
So a lot of
1995.
emotions going on. A lot of
A
yeah.
lot of emotions. So, yep.
Mortality is so it hits you hard.
Yes.
So
So go ahead.
go ahead. No, go ahead.
So the first kidney transplant in July 17th, 2024, was very touching to me, and I get so emotional because it was from a 5-year-old girl that passed away in a car accident. She was only 45 pounds, and I was blessed to get two of her kidneys. Even though it didn't work, she still basically lives through me because her kidneys are still there. And then the second kidney that I got last year on the 28th was from a 60-year-old gentleman that passed away from another accident. And I got the call on the 27th, actually, I got the call. And they told me that this gentleman has a 50% chance of living. And we're getting ready to take him to the operating room. And so if he doesn't make it through the night, are you willing to accept one of his kidneys? And that was,
It's hard because you want him to make it.
I couldn't sleep that night. I just couldn't. I was like, Lord, please let this guy live, And then I got a call around about 5 o'clock in the morning that he had passed away. And so they gave me one of his kidneys and then someone else got the other one. And I just,
Mm,
that just,
powerful.
uh, my emotions were all over the place. So I was blessed to receive his kidney last year.
Mm.
So,
So let's go back to the first kidney. So how does that work when you have a kidney, it's failing? So go through that.
so when the kidney is failing, there's so many side effects, so many, I mean, symptoms, I should say. Um, your appetite is somewhat good, but what I really started noticing, and I didn't realize that this was a sign that it was getting worse, or even a symptom that I had it really, was I was nauseous all the time. Even with brushing my teeth, I wasn't even brushing the tongue, and I was ready to throw up.
Hmm.
Um, Constantly fatigued, tired, like extremely, extreme, and I couldn't figure out. I would sleep and still be exhausted all day, every day, and I couldn't understand. At that time, I was like, "What is going on with me?" And I would say these different things to the doctor, and at the time, the doctor was like, "Oh, maybe this is this, maybe it's that." We were just going around in circles and not really addressing it's the kidney disease because keep in mind the kidneys were still functioning, but they weren't functioning at a normal level. And then I started itching all the time and stuff, and that was from the result of having a high phosphorus level. And when your phosphorus level is high, usually, your body tries to get rid of it, and it ends up coming through your pores or your skin. And so you start itching, and you get these rashes, and
So
because
how
it itches
long
so
did
much.
you start feeling that way after that first kidney from that 5-year-old?
When the kidney started failing, from the 5-year-old, I started noticing because I remember my other symptoms when the kidneys were fail. My kidneys were failing.
Mhm.
I started having some of the same symptoms. My legs were ankles were starting to swell up, feet starting to swell up, hands starting to swell up, and then I was getting very tired and stuff like that. And now this new symptom I wasn't aware of it was my stomach, lower part of my stomach, because they put your kidneys in your abdomen when you get a transplant. Started to get real puffy, like I was holding a lot of water. And so I went to the hospital, and of course they immediately got me in there, and then they tried to start anti rejection medications to help. Hopefully, the kidney will come around. It
Mhm.
started to act like it was going, ready to come around, and it was struggling a little bit, but it didn't. And the reason why it didn't was because once I got out of the hospital, things were changing. Like I said, it was starting to come around, and then I started developing a fever one morning. I couldn't understand it. And so my transplant center is far away from my home. I said, well, I'll just go to the ER locally. Shouldn't have did that. So I went to the ER locally.
Mhm.
I said to them I had a kidney transplant and different things like that. And they tested, said, "Oh, you got an infection." And me not knowing all the medical medicines and all that, they said, "Oh, we're going to put you on this antibiotic." So they put me on the antibiotic. And the antibiotic that they put me on was vactamycin. Wonderful antibiotic, powerful. Well, with a kidney transplant patient, you're not supposed to give it to them in the IV because it will basically take your kidneys out.
How did they not know that?
so, so once my transplant center found out, they said, "You ship him here right now."
It's
So they,
horrible because I don't mean to interrupt, but like I have hospitals here that you just do not go to because they are not with it. They don't get it. They're just, and it's so
yep,
unfortunate. God, it's so unfortunate. So
So so I ended up at my transplant facility, and my surgeon, oh, he was hot. I mean, he was so, I didn't even know why he was hot. So he came in the room. He says, "What's this doctor's name?" And I told him. He said, "I'm about to call over to this hospital to see what was what." He called. He had the lady on the speakerphone, which I'm surprised he never stepped out the room. He's called on his cell phone. He
Yep.
says, "What did you give him for this infection?" She says, "Well, I gave him Vactamycin." He said, "You did what? You don't give a kidney transplant Vactamycin, especially through an IV." And I heard the doctor on the phone. She says, "Well, I did it now. He got it now." I wasn't supposed to hear all this. I think he should have been out the room when he was calling this doctor. And he says, "Well, goodbye." He hung up the phone, and he told me, turned around. He says, "We're going to try to save this kidney." But he says, "My friend, I have a strong feeling they wiped this kidney out." And after that situation, yep, the kidney failed completely a
So
few days later.
is there anything that you could do with that situation since it was a
No, not really, because it's kind of one of those things where, because I
yeah,
asked him that too. He said, "No, unfortunately,
yeah.
no, because they were actually treating an infection, but they should have known that you don't give
I mean, at least look it
patient
up. At least Google it. Am I right?
right." But you can get back to myosin, but you have to get it a different way, like maybe through pill form or something. Like you just don't. Vactamycin, when it comes to kidney transplant patients, you have to be very cautious. Kidney disease patients, period,
Yeah.
on giving that medication. You can't just do it as with a regular person that does not have kidney disease. And he said there was other ways that they could have done that. And so here comes the interesting thing about that. After testing me, when I got back to my transplant center, I did not have an infection.
Shut your mouth.
Because when they do these testing for infections, sometimes it takes a while for the lab to get the results, sometimes a couple days. And they treated me right off the bat as if I had it as a precaution.
Right.
So, yeah, I'd been through a whole lot. So now the doctor told me then, he says, if when you get this next kidney, if you have to go to the emergency, unless it's something terribly serious, you come here.
Right.
So now I am so cautious to even going to any type of doctor that I usually see. When they give me any medicine, I tell them I'm not taking it until I talk to my transplant doctor. It's like, oh,
Amen.
here, that's fair. I won't even go pick it up until I talk to transplant
Right.
to make sure I could take this medication.
So so now you knew you had that other kidney from that 5-year-old that you could use? Is this how this works?
Yeah, the 5-year-old kidney,
Right. I thought you said you had two from I thought you said
I was given two of her kidneys. They both failed.
okay, so this was the first fail, correct?
Yep. hmm
All right, so if you want, because I'm invested now, tell me how the next one went.
So the next kidney transplant after the 60-year-old man, male, he's doing this. He's doing, yeah, might as well say he's doing well. So now I know what to look out for. I know what I'm not supposed to be taking, and if I get some medication that doesn't sound right, I always call before I take it. I am very, very cautious now to where my transplant facility, they know me by name. As soon as I call, and they say, "What's going on, Reggie?" They see me on the car. I call him so much now
Sure.
that they know me automatically.
Uh,
To where my surgeon actually gave me his cell phone number. Yep.
oh,
So now I can, if I don't get an answer that I want to hear from the nurse coordinators, I call him or I'll text him.
So,
Yep.
are you on anti-rejection medication?
Oh, yes. For the life of the kidney, I have to take those every single day.
Now, me being ignorant again, what's the life of this kidney could be? What's the possibilities for the future? What as a kidney transplant patient, like what is your trajectory? Like what do they say? How does this work?
Well, for a kidney transplant patient that gets a deceased donor kidney, I mean, it could last 10 to 15 years, and it can go even beyond that. I know someone that's had a deceased donor's kidney, and they haven't had it for 35 years.
Okay.
So, it all depends on number one, how you take care of it. Are you eating the right things? Are you exercising? Are you keeping your appointments? Are you taking your medication like like you're supposed to? So these are the things that you have to do. And believe it or not, some kidney transplant patients say, I don't need this medicine anymore. I'm fine.
Well, I believe it because that's with everybody typically, right? Depression
Mhm.
medications, GLP-1s, whatever it is, right?
Mhm.
And we can do our number. We can be our own worst horrible, person for our health. Um, Finish your thought before we answer Anne Marie's question if you were still talking about it.
So just keeping up with the medication, asking your doctor, can you exercise and different things like that. That's vital for the success of your kidney transplant. But go ahead.
Yeah. So anti-rejection medications, like
Mhm.
how do they affect your immune system? How does that work? Like,
Well, the anti-rejection medications suppress your immune system. So you really have to be cautious. Like with me, like my white blood cell count right now is severely low, and we're trying to get it to a low normal. It will never be normal because you don't want it to really be normal, according to the doctors, because you don't want your body to attack the new kidney. So you're going to be on anti-rejection medications for the life of the kidney, and sometimes, like I'm on two different ones. I'm on an oral pill, and then I'm on a infusion that I take. I get the infusion every 30 days. So, and you have to be faithful, especially with these pills, because if you don't take your medicine, you can start rejecting soon. So you have to take your medications like prescribed when they tell you to take it. You can't say, "Oh, well, I'll wait 5 or 6 hours. Or I'll just take it tomorrow, or I'll just." And always call your transplant team and let them know, "Hey, I missed my dosage," and they'll give you instructions on what to do. They'll say, "Go ahead and take it," or they'll say, "Take it in the morning, but don't let that happen again." So you just have to be very careful when it comes to taking these medicines. Make sure you're taking them on time because they're very vital. If you don't take anything else, they will tell you your immunosuppressant medicines, make sure you take them. There was a lady that was on the news a while back. She went out of town, and I think she went to Jamaica, I think it was, and they had a hurricane. And she didn't have enough medication. I still want to know how that lady made out with that. And she couldn't get them when she was over in Jamaica at all. And she was over there for a month without medication.
hmm.
I didn't hear anything else about that story, but I would have liked to known how did that work out without her medicine because she only took enough for her, be on her trip.
Hmm.
So I learned from that situation: take more than enough.
Yeah.
Take all of your medicine. If you got to have Ziploc bags with you, take all of it because you just never know when you go out of town.
Yeah.
So,
So for
yep.
you, did your parents have any issues? Did you know this was coming? Did you know this was even a thing that it just seems so random to you? Like, boom, like, tell me your history. Like,
It's genetics.
okay.
You know, kidney disease, high blood pressure,
Yeah.
diabetes, all that stuff runs in the family.
Okay.
So yeah, so it's genetics, and it's important to know your genetics too. Now there, I believe they have genetics testing out there where people can find out different conditions to see if it might arise in you one day that you can get. I don't think insurances cover it like that. Maybe they are starting to cover it because I still would like to know some more about it. To see if I can get tested for stuff like that to make sure, so I can be preventative just in case.
Now,
You
are
know,
your parents still around? And
my mom passed away. Dad is still around.
okay,
Yep.
I gotcha.
And she had kidney disease.
She did.
Hmm.
Okay. Did she have the help that you have? Like, did she?
She didn't really know about it.
Okay,
She didn't really know about it until she passed away.
interesting.
Yep. So that's
So,
why it's vital.
yeah. So let's talk protein
Hmm.
and how that can be, how you need to be careful with that with kidney disease when it comes to just these medications that we're on. And we're always talking about protein. And as a kidney, patient like you, how does that work for you?
Protein is good and it could be bad at the same time when you got kidney disease. That's why it's important to check with your doctor and ask your doctor, how much protein am I supposed to have or can I have any?
Mm.
Um, because it can harm your kidneys possibly if you're getting too much, and it can harm them if you're not getting enough. So, and it again, it all goes with your doctor and your blood work. Um, to ask your doctor. See, a lot of times people just think they can just do whatever they want when it comes to certain things. I'm just going to take this, or I'm just going to eat whatever, and you can't really do that. I mean, like even this source here, TikTok and YouTube, and it's good information to learn from other people, but you have to check with your doctor to see if it's okay. I wouldn't start taking something just because so and so said it. Let
Right.
me check with my doctor, and if the doctor says it's okay, then go for it. But you always need to, and you all emphasize this so much. Make sure you check with your doctor.
Yeah.
Make sure because it's important. You don't want to harm yourself.
Right. So, for anyone listening, because I have this in my chat a lot where it's like, I have kidney issues, or can you take this for kidney, or is this going to help hurt your kidney? Talk about this treatment with your kidney disease and what it's done for you.
GLP-1s have helped me significantly. Blood pressure is almost normal. I'm thankful for that. Inflammation is about gone. It's helping with kidney levels. It's helping with the toxins in my system. I mean, the heart disease. I forgot to mention that I end up with congestive heart failure with kidney disease.
Mm.
That's been reversed. I have no more pleural effusions in my lungs. That's been reversed. Um, a lot of stuff has happened since I've been on these GLP-1s that have really helped me significantly. It's just it's a blessing. It's amazing. And so when I first started the GLP-1s almost 2.5 years ago, I was amazed that the pleural effusions just left.
Can you explain
And
that for people in the chat?
so the pleural effusions are like these in your lungs when you breathe in. It's basically fluid around the sac of your lungs. Especially when your kidneys are not functioning well. Your fluid backs up in your lungs, it backs up in your heart, and that's why I ended up with congestive heart failure and pleural effusion because your kidneys are not at the time were not able to get rid of the fluid, and so it had to go somewhere. And so it was going around my heart and it was going around my lungs. And so when I got on the GLP-1, it helped with the inflammation and it helped get the fluid out of my body as well. And I thank God for these medications. And so when I was off the medications for a little while, some of that stuff started to reappear. So my cardiologist is so thankful that I'm on this medication. And like I told you all, that he wants me to go to the top dose, but transplant was like, slow down here. Just stay at the dosage you're on.
Right.
So, yeah, so it has significantly helped tremendously with my health, and I'm so thankful for that. I tell you what, looking at my lab work and seeing everything in the green lately is like I haven't seen that in a long time, and it's and partially because of the GLP-1 medications.
Mm, I love it. Thank you
Hmm.
so much for sharing, being so open about it. Thank you for coming up here and sharing your story and showing your face and
No
allowing me to ask the
problem.
questions and stuff. It's so important to hear these kind of things.
Yes.
It brings it all into focus on how we need to take care of ourselves, how we need to educate ourselves, how we need to talk and ask questions to the doctor, right? All of that.
Can I answer this? Well, it's not a question. It's
Absolutely.
Jen down there says my MIL is on a kidney transplant list. She is on Monjaro now to help her get ready for. Yes, yep. And a lot of these transplant teams and kidney doctors are starting to put patients on GLP-1s to help them get these organ not only just kidneys, liver and all other types of things to help people get ready for their procedures and to get organs. So that is awesome. And so since I'm reading all these comments in your chat, it seems like a lot of people know people are dealing with kidney disease.
Absolutely.
So they say
That's
one
why,
in
Reg,
three.
that's why, Reg, when you were saying that you want to make a channel talking specifically about this thing, I think it's absolutely needed for sure.
Yes.
What a great avenue to go into with
Yep.
these medications, right? And talk about it.
Yep. Wow. I'm so touched by. I really didn't realize how many people deal with kidney disease. They said one in three, according to the National Kidney Foundation, people have kidney disease and they don't know it.
Mhm. So yeah, it's one of those things where you talked about it first, like your doctor, there was no discussion at all with you until you got to stage 4 or whatever it was.
The low end of stage 3, upper end stage 4. Yep. That's when they said, "Hey, by the way, you got kidney disease."
And is that normal, you think, or is that just something that happened with you, or?
A lot of times they start introducing it to you around those stages. Um,
Mm.
and then this is what they told me. Now we're just gonna watch it, and hopefully you won't have to go on dialysis and
You're like,
stuff. So
what can I do?
right. Well, see, I was going about my day to day journey. When I was in that restaurant, I wasn't really, I was like, oh, kidney disease wasn't even in my head. I knew I had it, but it wasn't. I didn't think that night I was going to be on dialysis. It went from those levels to stage 5 fail. Isn't that something? I mean, and we had just talked about it, and it progressed that fast.
You see Carrie's comment. I'm sorry, Carrie.
I'm sorry, Carrie.
Mhm.
I'm so sorry. And people that I was in dialysis with, some of them have passed on,
Mm.
and it hurts me to my heart because one of the kidney patients, she's still alive though, that was in dialysis with me. She would come into the dialysis center and she would say to all of us, "Hello, classmates. These are all my classmates. We're all going through this. We're learning together."
Mm.
And she
Mhm.
used to always say that. And it touched my heart, because we all talked to each other. We sat next to each other, encouraged each other. And then when one of your classmates pass away that you started off with and no longer here, and you talk to this person every day, it's hurtful. It really is. Really,
Sorry,
really is.
I get emotional too.
Yep. It really is. So
But that's why we're here. That's why we're here to support, encourage, educate, let people know they're not alone.
yep. So
Well, you've been through a lot. It's been so awesome to have you up here.
well, my pleasure. My pleasure. So
So,
always stay well informed. Reach out to the National Kidney Foundation. They're there to help. They got so much information. They have so many different free online Zoom classes that you can take. It's very good to get in touch with them because they're some wonderful people. Some wonderful people.
one last thing, if you have any wise words of wisdom for ones in the chat that are maybe anxious or worried about taking their health back in general, not even necessarily about the medication of GLP-1s or whatever. From your lived experience, what would you tell them? You know, what would you say to them if they're worried about starting or educating themselves?
The number one thing that all of us kidney disease patients talk about is stay on your doctor. Stay on your doctor. Don't let them just write it off and say, "Oh, don't worry about it. You're okay now." Stay on your doctor and tell your doctor, I want to know what it is that I can do to preserve my kidney function. What can I do? And I'm not going to let it rest until I know what I can do to keep up with my kidney function so that I can preserve it. So don't let your doctor just say, "Oh, don't worry about it." No, I am worried about it. I don't care what kind of condition it is. I am concerned about it. I need to know what I can do to preserve it.
And I think that's so important because sometimes, we're sitting in there and we're looking at this person who has got all these degrees and he's the expert, and we listen and we just kind of just go, okay, and move away and leave and not really feel like we can express ourselves or ask questions or be demanding or want answers or whatever. And it's so important to ask those questions and to take your health seriously because it's your body. It's
Yes.
your life. And if you don't understand, ask more questions. And if you need to get second opinions, get second opinions.
Yes.
And that's with anything, even with this medication, GLP-1 medication, right? So much, I think, with this because, we need to know, we need to educate ourselves.
Yes.
Yeah, mush, absolutely. So, Jen, you're right. Absolutely. Yeah.
I'm just so glad that everyone in this community, we root for each other and
Hmm.
we support each other big time. And I'm so thankful to be able to find this community. So now I got my GLP-1 community and I got my kidney transplant community. So I am so thankful for that.
Absolutely. Um, I don't know what that is, Angel. Do you know what that is?
What's that?
Gloss?
I don't know what gloss is.
Maybe she typed wrong. But let us know, Angel, what you mean specifically. Um, but yeah. Thank you for coming in. We don't have to stop talking now. I don't know what else to say. If anybody has any questions in the chat, let me know. Lip gloss. I know. Maybe Cece. I don't know.
It's just,
I hope not, because I'm screwed. I'm just kidding. Uh,
so look at the ingredients in your food and
yeah.
and try your best to stay away from processed food. That's one thing they taught us. The processed food is, you
Yeah.
know, sodium, way too much sodium.
Yeah.
So
Absolutely.
glucose, yeah, sugar. Yep. So those are the things that you can just take steps and nutrition. That's why I'm really excited to have a dietitian because she helps me so much. So if you can, see if you can get you a dietitian.
Yeah, and speaking of that, before we move on to Button's comment or question, if you guys have insurance, call your insurance today and ask for medical benefits nutrition therapy. That's seeing if you have a dietitian. Medical benefits nutrition therapy code 97802. 97802. That's going to see if you have a dietitian that's covered somehow and get in with that and see if that can help you. She's asking, what's good for chronic kidney disease stage 3?
What's good? That goes back to that diet, that nutrition. What works for one might not work for others. And the reason why I say that is because too much of something may not be good. Like for me, I was eating, and I could still eat it, but not as much. I was eating too much spinach. And so spinach has high oxalates in it. And so high oxalates can cause kidney stones. I didn't get kidney stones, but I was going a little bit overboard with the spinach. And he told me, slow down with the spinach. You can eat it, but don't eat it all of the time. And so I had to learn that. Like kidney transplant patients, one of the things we got to stay away from is grapefruits because it interacts with your immunosuppressant medication. And so that brings me to this point. Like some of the medications that you take, some foods interact and those medicines may not be effective. So that's why you have to always make sure you check with the dietitian to see, hey, can I eat this or can I not eat this and stuff like that. Like I just found out the other day that I'm not supposed to be eating too much ginger.
Yeah,
You
it's
would think, oh,
important.
that's healthy.
even with heart disease patients, there are certain
Yeah.
things you cannot, even with people who make too much, like hemochromatosis, too much blood. And I mean, there's so many things when it comes to food that we need to stay away from. Um,
Dietitian,
so it's
dietitian,
so
dietitian.
incredibly important. So someone wanted me to read it again. So it's, you want to ask your insurance for medical benefits nutrition therapy, code 97802. Um, let's see. So we had someone ask about calories. So again, Lucinda, I love that name. Um, we all have a total daily energy expenditure that we need to look at, right? So we burn calories in 4 different ways. We burn calories by just being on this planet, like if we're in a coma state. We burn
Yeah.
calories by fidgeting, just kind of moving like this. We burn calories by eating thermal effective food. We burn calories by working out. So that total daily calorie count that us individually have, we usually knock off about 500 calories from that. But the TDEE calculator is a nice place to go for a nice healthy range of where you need to be. TDEE calculator. You fill it out and it'll help you find out what your caloric intake is daily.
And also, too, could I add to, well, well, it's still a part of your health. Kidney disease patients, a lot of us, and at the beginning, I was seeing a therapist. Sometimes it's good to see your therapist too, to talk, so your therapist can help you because kidney disease, and people don't realize it, it can affect your mental health as well. So therapy is very good as well to try to help you get through um, this whole
So much.
process.
So much. I mean, all of it, everything, mental health is so important. It affects.
Yeah.
Yeah,
And a lot of
absolutely.
people don't understand that. Um,
Mhm.
when I actually got on dialysis, I signed up for every class I could sign up with for the National Kidney Foundation because I was clueless on how I was supposed to function with all of this. So every class, every time I had a meeting with the dietitian, I was there because I
So
wanted to know.
it's interesting. You're stubborn man. You told us this before. So before you had any of this, were you that type of person where you just looked into it and you delved into it and you were interested in your health and you did the thing?
I just went with what my doctor said, like, oh, don't worry about it.
Yeah. So knowing the difference between being that typical man, maybe, of
Mhm.
not really taking care of your health, not really pursuing, the knowledge and education you need, and
Yeah.
but then doing the other thing because your life is on the line. What
Right.
would you tell someone who is kind of nonchalant about things like that?
Don't be. Don't be nonchalant. Be serious. I don't care what kind of medical condition it is. Be serious about it. Um, it, so many people around even my age, the younger generation,
Mhm.
a lot of them just whatever, 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 until something goes down. Now, they want to take action and stuff like that. You can't just be whatever.
Mhm.
I know another person that um, had kidney disease and did not go on dialysis and said that they didn't need it and they passed away.
Yeah.
And a few weeks before they passed away, they asked could they get on dialysis, and it was basically too late.
Mhm.
So don't be nonchalant. Any health issue is a serious condition to me, a serious issue. I don't care what it is. Because as you can see on the news and different things, you're hearing different stories from people that just had a minor something and they were like, oh, that's nothing. And it turned into something serious. I mean, you have to, number one thing, a word of wisdom, pay attention to your body. When your body is going through something, it basically speaks to you. You have to pay attention to your body. If something doesn't feel right, call your doctor. Get in to see your doctor. Just say, hey, I'd rather for them to tell me there's nothing wrong than me just blowing it off. You know, everything needs to be, you need to give attention to every single thing. I mean, you can't just blow something off. I had a coworker one time, he had the hangnail in his finger.
Mhm.
He says, oh, I'll just do this and then get rid of it. He ended up almost getting his finger chopped off because he just blew it off because it ended up with sepsis.
Yeah, that's a serious thing. I have stories with that. So Liz in the chat, we've had Reggie on today. I'm going to put this on YouTube if that's okay, Reggie, this
That's
conversation,
fine.
because it's been really enlightening with the kidneys and how these medications work and all of that. So Liz's question is this medicine affecting our kidney liver? Now, she's thinking maybe negatively, but tell us, Reg, really quickly so we can move on, what this is doing for you medication wise when it comes to your kidneys.
Talking about GLP-1.
Mm-hmm.
For me, GLP-1s have helped to maintain my kidney function. It has helped to maintain that as well as my BUN. The BUN basically it shows the level of basically the toxins in your system. It has helped to manage that as well. Um, I don't have any negative complaints. The only thing that I complain about every now and then is, right after injection day, I'm really wore out, tired, a little sleepy and stuff like that. And I kind of drag like that. But you know what? I'll take the tired and the sleepy to have better health. You know what I'm saying? So the medication for me, again, has helped me significantly. And I'm not saying now some people it may not work for them. But for me, it has changed my life significantly, and I'm glad that my doctor told me about it, and I'm glad that I'm still on it. So, yeah,
Well, you've been through so much, Reg. Thank you so much for coming on here and speaking so candidly.
no
It
problem.
needs to be talked about. I mean, both of us tearing up and crying on this chat today. Oi,
I know. It
but it's
just
real and it's important.
yes.
So thank you again for coming up. Anything you want to end with? Anything last minute thought for people in this chat, maybe?
I see a question. It says, "Do you know anything about the recovery for a donor kidney?" Oh, I don't really know too much about that, but I have heard that when a person gets a kidney transplant from a live donor, that the outcomes are really, really good with that. But I have heard that some people may have a little bit of a setback sometimes, but I haven't heard much about being set back. Usually it's all good and everybody walks away happy and healthy and stuff like that. So yeah, that's another thing. If you know somebody else that needs a kidney and you're thinking about being a donor, reach out to that person, because there's a lot of people that even put on Facebook that they're looking for a donor, someone that might be able to donate their kidney to someone. So if you can do that, that's awesome. And then learn more about that as well, because sometimes if you're not a match, they have something about a donor swap program I learned about, where your kidney will go to someone else, and then that person, the other person's kidney that might match the individual that you were going to give it to, they'll give that person their kidney, and then you will give that person your kidney from another place. So it's
Yeah.
like a swap program. So you can learn more about that with different transplant centers and stuff like that. So that's an awesome opportunity to be able to give a kidney, any organ. If you're transplanting any organ, that's a awesome thing to do for people. And there's a lot of people out there that are waiting on organs, and some people unfortunately have passed away waiting on a organ transplant. So if you're willing to do that and you feel it in your heart, reach out to those kidney transplant centers and they will lead you throughout the process.
Mm. There was a question earlier that we didn't answer. Just curious. Did you get to meet the 5-year-old family, their mom?
No, or the 60-year-old. So right now, actually, my nurse coordinator, we're in the process to try to get the information so that I can write them and let them know how appreciative I am about receiving the kidney transplant. So, and you can communicate back and forth. Once you get the information, you can write back and forth and different things like that. And some people have actually flew out to where the person was and actually met the family and different things like that. So,
Yeah.
yeah,
Yeah. So Jen's just worried about her health later if she were to have done
donate.
something. Yeah.
And so, and with that being said, they're going to do a thorough evaluation of the donor. So don't just think if you give a kidney, you're just giving it and they don't check you out. No, it's a thorough investigation of your health from top to bottom before to see if you're able to donate a kidney to an individual. So no, it's a very long process, but if you can do it, it's really worth it to do it.
Mm, I love it. Good, Jen. That's awesome. Keep us posted, please. Before we go, if you have guys any last minute questions, both of us, when it comes to GLP-1 medication, how they work, what they do, health journey related, anything like that at all, please let us know in the chat.
I know they're starting to look um, more at kidney patients with the GLP-1s and transplant patients, and they actually want to hear from us. I'm starting to learn.
Yeah. Are you able
Yeah.
to?
I'm working with the National Kidney Foundation right now. We're trying to, they're actually trying to get some things together. We actually had it was a lady that came to one of our support group sessions, and she took questions from all of us on kidneys and GLP and all that. So to try to figure out how it's helping people with kidney disease. So um, I'm supposed to hear more about it, and then my nephrologist, he's a professor, and he wants me to actually go around and start speaking to other kidney disease patients and transplant patients here coming up soon, I think, and then actually wants me to talk to his class. So that's I'm gearing myself up for a lot of different things that I'm going to be dealing with kidney process and helping other people. So learn more about it.
Now, Reg, you had mentioned that you would like to have some sort of platform here where you go live and you talk about this kind of stuff. Is that correct?
Yes, actually, it's going to be me and a couple of other people that we're trying to map this out how we want to do it. The other two people, they have kidney disease. One's actually on the transplant, well, on one transplant list. He's trying to get on a couple more. He has a really significant story as well. So yeah, so we're trying to figure out how we're going to get this going because it needs to be going. So, because a lot of people need to hear about kidney disease and transplant and different things like that. So, when we do get it going, we are hopefully going to have doctors and nurses and dietitians on our lives so they all can talk about this information to help other people succeed with kidney disease.
I love it. So, you guys, if you need to follow, if you need, you want to, you need to follow Reg right here. You click his name right here. And then once you click his name, I think his name comes up again, and then you click that, and then you're following him, right? So, Reg, are you private still, or are you not
No,
private?
it's you
Okay.
should be able to follow.
Okay, perfect. Thanks, Jen, for being here for sure. So make sure you guys, 66 of you guys, if you haven't followed Reg yet, please give him a follow because he will be such a great asset to this community. What were the first signs that something was wrong? Molly asks.
The first signs that with the kidney disease, that's like was mentioned before, nausea was really my first symptom. I'm telling you, like, just regularly, like I said, not even brushing your tongue, but just brushing your teeth and you want to vomit, and it started to do it every single day. And then to the point where uh different smells, just not even smells that were strong, but like even perfume or cologne and stuff, I started to want it to vomit. I remember going downstairs and getting in my car and just getting in the car driving, and sometimes you could the fume. I mean, and just instantly wanted to vomit. And sometimes I did. But that was starting to get regular, and I didn't understand. I said, I know I can't have a stomach bug this long going on.
Mm.
And so it just got worse and worse and worse. And I said something, and that's how I knew that the kidney disease was progressing, um, with nausea and
Mm.
stuff like
Is
that.
that a side effect that happens to everyone, or is it all just differ? Or now that you know about it more, like, was that just something specific to you, or just?
It was something specific to me, but then once I found out from the doctor, he said, yes, that is one of the symptoms. And believe it or not, now this is a weird one. I didn't know this, that I was yawning all the time.
Oh, great. That's
Like,
me.
but wait a minute. I was doing it so much that I didn't even realize. I was like, why am I yawning so much? And I just kept yawning and yawning. And then when I went to the doctor's appointment and I was sitting there, he says, "You've been yawning a lot. Now that's concerning." And I was like, concerning. Um, he says, "Yeah. He says, you haven't had any headaches or anything like that, have you? I said, no, not really. He says, he said, but you do have kidney disease, and that could be, the toxins in your system. He said, but I'm even more concerned because I don't want you to have a stroke. And I said, what?
Reg.
And then because no, that I was like, oh my goodness. And I came home and read that. And I guess you wouldn't think that that could be one of the symptoms
Right.
so I was like, oh my goodness. And I would have never known if the doctor had says, you yawn and yawn. I might have to check this out. And so, see, a lot of see, as simple as that. I mean, not saying that you yawn, that you're having
Yeah. Yeah.
just, but if something becomes a little bit way too much, you might want to
Nikki's in the chat.
check into it.
New fear unlocked.
Now, Nikki, don't be fearful if you're just yawning, But mine was way too like I would yawn, and then the next second I would yawn, and then the next second I was yawning, and I just couldn't stop, and I knew I wasn't sleepy, And I said something's just not right. And
I'm
then
seriously yawning right now.
when he looked into it, I was like, oh my God, I didn't know that could be that. Um, so when doctors, and see, this is what gets me about doctors. When they ask, let me tell you something. When doctors ask you some questions like that, you better listen to them. Like they say, well, why are you yawning so much? And then you're thinking like, I never had that question. Oh, something must not be right.
Yeah.
And then he was like, well, you do have kidney disease, and it could be your body, another way your body trying to get toxins. And then he said, but I don't want you to have a stroke. So
That's when the communication happens. You start talking to him. Ask him all the deets.
yeah, so just like I say, listen to your body. If something seems way out of place, check with your your
Yeah.
doctor. My eyes were twitching and all kind. So anyway, just check with your doctor on everything to make sure things that are going the way that they should. Like my immunosuppressant medication that I take right now, it causes your eyes to jump, twitch, stuff like that. Yeah. So, and I want to let you know that transplant is a wonderful thing, but it comes with its set of issues too. They told me in transplant, this is a treatment. It's not a cure.